taken over this month. We would like to place on record the excellent work done by the audio team headed by Ms. Jayashree. We hope to continue the good work to make these seminars vibrant, lively, and enhance the work going on in the foundation. These seminars, just to give a quick brief, it's fortnightly in nature, and we'd like to balance them with external speakers and our own colleagues from Chennai and all our field centers. So these seminars help us learn laterally, as we all know that, and we'd like to adopt these interventions across our work areas when we work with communities. We've made arrangements for these seminars to be made available to all our staff through video conferencing, thanks to Kanappan and Tamil. And we'd like to have these seminars also by the field staff going forward, and we'll have it both ways. We have been fortunate to listen to eminent scientists from across the world, including Professor Bruce Alberts, former editor-in-chief science, Professor Jeffrey Sachs, director of Earth Institute, to name a few, as part of the Millennium Lecture Series here in this very auditorium. Today we are extremely delighted to have with us Dr. Darez Ahamed, the district collector from Perambalur, to share his work and experiences. And I invite Ms. Meena Swaminathan, Distinguished Chair for Gender at MSSRF, to kindly chair and preside over the session. Over to you, ma'am.
Ahamed, who is going to give a talk unlike anything any of us have ever heard in this hall. We are used to hearing, as Rajalakshmi pointed out, scientists and specialists in scientific disciplines usually. But here for the first time, we are going to meet somebody who's actually doing something in the field to promote all the things that we only sit here and talk about. So here is one of the most distinguished IAS officers in the cadre. He is the winner of several awards. I must tell you that he comes from Kerala, and I think we have a number of people in Kerala, and I hope they're hooked up and listening to this from Wayanad. We also have many people from Kerala and our staff all over the country. We are very proud to have one more distinguished person from Kerala with us today. He has had so many awards that it will be difficult for me to summarize them, but he has been voted the best collector collector for disposal of petitions, for implementing schemes for differently abled, for e-governance, and for implementation of quantity delivery system, and for environmental protection. For each of these, he has received the Best Collector Award, of course, in different districts. Since 2011, he has been collector of Perambalur, a very small and remote place, which probably most collectors would not like to be posted to. It's far from the city and it's not a very exciting place to live, many one would think. But actually he's very, very happy there, so he says, because he's able to do more work, meet people frequently, and keep an eye on every program and scheme which he has to look into, whereas people working in the larger districts cannot give so much attention either to individual areas or to individual projects. So here you see a person who turns what others would think a punishment into an opportunity and uses it joyfully to the good of the people, and also enjoys that very much. So I would now, his latest award, 2013, is for public, 2012-13, is for public administration for Save the Girl Child. That is the latest one in a long string of such achievements. So now, ladies and gentlemen, I invite Mr. Darez Ahamed to speak to us about his work.
Good morning all. First of all, thanks madam for a very generous introduction. And actually it's a great honor to stand in front of the legend itself and speak about some work I have done. And we all grew up looking up to him, how to, in your work, how to help people in whatever you do. And sir, you have been an inspiration for a generation of people like us in able to solve people's real problem in real time. And thank you for giving me this opportunity to speak before here. I'm really humbled by this opportunity. First of all, I would like to ask you something like, what would you like to be the talk? You can interrupt me anything, because this is what we have done. This is not a structured lecture or something. It is just my experience, what I've experienced in the district. And first, can we start with a small video, or if you are able to, can just dim the light a little. This video is about, it's a thought experiment. It's about two people. I don't know if somebody has seen this video before. If you have seen it, please, you can, I'll just play this. So it's about two group of students playing basketball. Have you seen it? Then you can keep to yourself. It's about the game between the person in white. There's one team of students playing in white and one in black. You have to count the number of times the ball is passed by the team in white. So I'll just play the video. You have to count the number of passes made. Any answers? How many 13s? Can you just raise your hands? How many 14s? Okay. How many saw a dancing bear in this video? A dancing bear? Did anybody see? Should I play it again? Anybody? You saw a dancing bear in this video. Okay. I'll play it again. Just see if you're able to see. Answer is 13. It's easy to miss. It's actually an advertisement by London, City of London, for not missing the cyclist. Okay, I found it very interesting advertisement. So, whenever we talk about gender, this beer is very important. Okay, especially in any facet of. Actually, again, I would like to mention, sir is one of the pioneers of putting gender into planning. I think, if I'm not mistaken, 6th 5-year plan. And even in his stint in Women in Rice Cultivation, if I am not mistaken, in 1983, sir, if I'm right. So the role of gender in agriculture, in everything, so sir is one of the pioneers. That's why I'm here, I think so. So my point is that gender is like the bear. It is not very obvious. And I'm not saying that I missed it first time. I couldn't spot it. I saw it twice. I knew that something was there, but still I kept counting. I couldn't see the bear twice. So when somebody told me the bear is there, it was very visible. So gender for me, as an administrator, it was like that. And how did I come to understand gender is very important. Is when I was preparing for civil service, I read an article by in great Amartya Sen. I already mentioned in my thing. So I'll come to that. So See, this I will concentrate basically on how we decline in sex ratio, how in Perambalur we try to arrest the decline in sex ratio. Sex ratio at birth is simple. How many boys are born to how many girls? Okay. For every 1,000 boys, how many girl children are born? I'm talking about only birth. I'm not what happens after birth and what happens. The mortality will decide the child sex ratio, CSR, at 5 years. I'm only talking about sex ratio at birth. Okay. Because I'll tell you why I'm concentrating on sex ratio at birth. Why is it important? I'll come to that later. So sex ratio at birth, even 2011 census talks about the same thing. So now I'll talk about my district profile problem statement. Why is it important? Magnitude, intervention strategies, role of stakeholders, key effort. All these things. There's a basic structure of the presentation. How much time do I have? 30 minutes? 25 minutes. Okay. 45. Oh. So I'll talk about Perambalur. Anybody from Perambalur here? Okay. It's not, mostly it won't be there. It is the smallest district. The poorest district in the state. Per capita GDP of Perambalur district is 17,000. Tamil Nadu is 40,000. So you can see the gap in per capita GDP is more than half. So it's actually rain-fed agriculture, 85% rural. It's completely rain-fed. And next time you meet somebody who speaks Tamil and who's a daily laborer in Chennai, in Coimbatore, or in a hotel, you ask him where he's from, then you will come to know about the district. 83% rural, ranks last in HDI, Human Development Index, and is female literacy 66.1. State average is 73, it's far below the state average. So this is the introduction to the district. And if you look at agriculture, Perambalur is the largest producer of cotton, maize and small onion in the state. Okay, all three rain-fed, completely Manavari agriculture. It produces almost 40% of state's cotton, 30% of maize and almost 35% of small onion, sambar venga. So these are the main producer. We have 1 lakh, since I should speak about agriculture, 1 lakh hectares of crops every, we don't have, single cropping mostly. 90% single cropping, only 10% we have double crop. Basically well irrigated, 36,000 wells are there in the district. So it's just about agriculture, the district profile. So I'll just go into the problem. I'll basically concentrate on sex ratio at birth, why it is a problem. Then I'll come to gender specifically. So there are a lot of other issues. It's not a freestanding problem. No gender issue is a freestanding problem. You cannot be seen at a single issue. It's a cycle of issues, which I will come to that later. That ideological or the structural framework I'll come to later. The problem I'll tell you, because since I'm an administrator, I'll tell you the problem and how we have done it. Child sex ratio 950 is the 12th 5-year plan goal. Increase of 0.6% from the baseline of 914 census 2011. Child sex ratio is influenced by sex ratio at birth and mortality in early childhood. But in Perambalur, the infant mortality rate is only 16. So IMR was not an issue. IMR is below the state average and almost MDG goals less than the MDG goal. So child mortality was not the issue for having a decrease in sex ratio. And missing women, this concept is one of the most, it easily captures the idea. In 2000, Amartya said in an article in 2001, says that there are 100 million missing women in the world. 100 million missing women in the world. It says that if you are not tinkered with the reproductive outcomes, you would have found 10 crore more women in the world. 10 crore. Imagine, he talks in 2001. Now, as per that, out of that, 46% was in India. Now it has become 50 million missing women. If you apply Sen norm, there are 5 crore women missing in the country. Okay, missing means if we have not touched the reproductive outcome. That is the magnitude of the problem. 50 million is a huge number. If you apply the Sen norm in 2011 census, this is what you will get. And there is act from 1994, we have been trying to reduce the pre-birth deficit. It's not a pre-birth deficit. Before birth itself, there is a deficit. So PNDT Act from 1994 is there, but still census 2011 says that there are 50 million missing. So PNDT Act is not the real solution, not the only solution. Something no more needs to be done. So that's why how it is, PNDT is purely a supply side intervention. It's like the scan centers supplies the demand, but there we are not intervening in the demand side. There is always a supply demand interface. Okay. So now if you look at a scan machine, latest scan machines are like mobile phones. It is only this big. It is chargeable. It is so mobile. It's only as big as a laptop, little bigger than a laptop. So controlling scan machine in the earlier sense is not possible at all. I bought a recently scan machine by Mindray. It is only 3 kilos, chargeable for 8 hours. So how do we control such a mobile scan machine? So PNDT is for a static institution-based scanning. So this is what is for you to think. And 5 sex ratio is important. I will just go through this. Is now child sex ratio biggest determinant SRB as per in Perambalur is concerned, or even Tamil Nadu is concerned. Among factors contribute to daughter deficit. Post-birth deficit is that infanticide. Kallipalu that you would have heard. Yeah. So post-birth deficit has declined while share of pre-birth deficit has rose sharply. Sharda Srinivas and Arjun Bedi 2009 EPW. Rural areas have a significant higher deficit than urban areas. Again, same article. Legalistic solution alone will not help us. Okay, PNDT Maharashtra has been trying hard to put in PNDT by silent observer, but it's again only is a supply side intervention. Demand we have not touched. So if you look at Perambalur, sex ratio at birth was 965, and sex ratio at birth is how actually if you look at a Scandinavian country like Norway, Sweden, you can please interrupt when I'm not clear because I'm not a speaker in the sense of the word. Please interrupt if something is not clear or if I'm going fast. You feel free. My thought process is there, so it will not be affected. So alarming decline in sex ratio at birth from 965 to 861. So there has been a decline. And what should be the normal sex ratio? If you look at Scandinavian country like Norway, Sweden, where sex selection is not at all prevalent, mostly, the sex ratio is between 950 to 960. Why? There will be lesser, some 30, 40 less number of female children being born because the survival rate of female children are higher. If you look at the life expectancy, females will have higher life expectancy than male. So survival of more male children die than female children naturally. So sex ratio will be 950 to 960. That is the natural sex ratio. But when you touch the sex ratio, tinker with the so-called technology advancement like ultrasound, it will come down to 861. It's a drop of 100 children for every 1,000. So now we started the Save the Girl Child initiative. And again, inspiration is, again, as you say, it's very, very important. Whatever social science or researchers do, and they put it down on public, our administrators like us only read. And without that framework, we cannot think through. Unless until missing woman was not there, I wouldn't even given it a thought. This is the truth. Now outcome is that last 2 years, now sex ratio has reached 963. This is the sex ratio for the last 3 years as per our health management information system. So we have again brought it back to 963. And can we say that the intervention can be seen because there is a control, because Perambalur was divided from 2 districts was there earlier, Perambalur and Ariyallur. Now it has been divided 4 years before. So if you look at sex ratio of Ariyallur, you look at Perambalur, it's like a control and a this thing. Ariyallur sex ratio will be 846 now. So I'm not saying just because it's a control and when whatever project is running, our project is not running. So I'm giving you this. Yeah, it's nothing to. So this is the 7 types of inequality Amartya says. Now I will go into that framework. One is mortality, where the more women are dying, or there is a specific death rate, high death rate of a woman, which is not there in Perambalur. That much I have seen. Except in adults and girls, there is not a very significant inequality there. Natality inequality, obviously, the birth, that is number of children being born. So this is natality. This is 7 types of inequality Amartya says. And this, you can put every type of gender inequality in this. Okay. Basic facility, education. Education is there. For example, 67% of girl children write their board exams from government schools, while 67% of boys write from metric schools. It's obvious that people put more money on male than female children. Okay. So I'm just giving you the data, I'll come to that. Special opportunity, obviously higher studies. Or if you look at the amount of children going for engineering or higher studies, now only we have started three arts and science college for women in Perambalur. If you see the intake of that colleges, 90% is first time graduates. 90% of children are first time graduates and 80% are women, girls. I'm saying that we have got three new colleges been announced by Honorable Chief Minister. So one is a women's college, one is two constituent college of Bharadasan University. And out of that 80% are first time, 80%, only in one college the 90% is first time. Average will be 80% first time graduates and 80% will be women. Now you can see that the pent up demand, because the colleges are free, almost free and very easily available, accessible in corners of the district. I'll come to the data later. That is special opportunity inequality. Professional inequality, you know glass ceiling and all this stuff, because it doesn't apply clearly. Ownership inequality, obviously, actually I've seen a very strange case of, look at in ownership inequality, for example, HIV orphans. I've really found this one of the toughest problem for me to tackle is that ownership rights of HIV orphans. How do we tackle, especially if it's a girl orphan? I find it very difficult. Even after my intervention, I'm not able to really produce results. So it's a different talk, ownership rights of orphans of HIV infected. That's a big other issue. I will not go into that. Household inequality, and it's on a dining table inequality. Nutrition. How nutrition inequalities work out in dining table. Okay. So I will not go into any of this. I will basically concentrate on natality. Mata says that it's a cycle of deprivation. For example, in Perambalur, we have stopped some 348 child marriages. Okay. Last child marriage was a 13-year-old yesterday, day before. 13-year-old girl getting married. Okay. I'm not saying it just to say you can. We had a lot of issues. We have a lot of religious issues in this. When I talk about inequality, when a 14-year-old get married, she is already a child bearing another child. The problem is that the nutritional requirement in your own home you are not able to ask and get. How do you go to another person's home and ask for nutritional needs, especially? So child marriage is very rampant. I'm not saying that I'm able to stop. 358 is one of the highest numbers. We had the highest number of cases registered, and we had a fatwa for stopping one religion-specific child marriage. And now only last month only High Court has upheld our order. High Court said that Prohibition of Child Marriage Act 2006 applies to everybody, irrespective of religion. So that order came. Justice Nagamuthu Singh, he has delivered the judgment 2 months before. If you search in the net, you will know. It's a Perambalur case. Anemic mother becoming mothers, and now what the child will have. Anemic mother giving birth to a child, low birth weight. Again, he will have. So it's like a cycle. The cycle has to be broken at different levels, nutritional level, child marriage level. So I will not go into. First, I will concentrate on sex ratio. Then I will come to the other aspect. I'll just concentrate on natality inequality. But there has got different aspects of gender in administration. I'll first start with one aspect. What are the interventions we did? See, sex selections, anybody can predict the sex of the fetus with clarity only in second trimester. You know, trimesters of pregnancy, first 3 months is the first trimester, second 3 months is the second trimester. So you understand the sex of the fetus in second trimester. So you can only see, we used to audit abortion. Abortions are the rarity in second trimester. Madam is a doctor. The spontaneous abortion is only 2% in second trimester. It happens basically in first trimester. So abortions are a very rare thing in second trimester. We used to audit abortions in second trimester. And I'll tell you, then we have to change our strategy a little bit. We have to go for male birth audit. Now, second trimester abortion audit had some problems. Then we had to shift to male birth audit, because what was the problem is that, so we started asking, first thing we did was, we registered every antenatal care early in the first 3 months. Ours is a rural area, mostly village, so it's easier to register antenatal mothers in the first 3 months. We can only implement this scheme, we have a very proper antenatal care regimen. So once you register, then you follow up on the outcome. How do we follow up on outcome? What has happened to the pregnancy? Has it become aborted, or is it continuing? So here, when you ask question, there is a question of people doesn't want to come out easily. They feel that, okay, why you are asking question, it's our right. So once it's aborted, it is difficult to elicit response. We had a lot of problems in, just an VHN can ask, a village health nurse has every right to ask about the outcome for pregnancy. What has happened, how did it happen? Now, then we had little resistance, now we went to another strategy, male birth. Now, second trimester abortion, there is something known as, in any act, there is something known as mens rea. Thinking about the crime, then acting on the crime, act as rea. So, mens rea is there, somebody goes and checks with the ultrasound machine, ultrasound center and see that what is the sex of the baby. But male birth, they wouldn't have aborted. So, it's easier for us to elicit the data from the male birth because they have not done any wrong. So we went on auditing, say first two female, third male child. So we went on auditing the male birth in adverse sex ratio. Now we did it health subcenter wise. We didn't go for the district. We first identified it in a habitation level sex ratio. We made a disaggregated data analysis. Understood that it's the newly emerging perimeter region is a problem. Really rural area, not much of a problem. The newly emerging, like near town panchayats and villages, there's a problem. So we identified the adverse sex ratio areas. Then we went ahead and did this audit. But it's very simple. Male birth near what? See, we have got one of the districts in the state, one of the first districts in the state where every PHC has got a scan machine. So we have got some 63 scan machines. So we have got only 120 panchayats, 63 scan machines are there. So there is logically there is no possibility for a mother to cross the border to another area. So mobility of mothers to check scan, there are specific areas, I will come to that later, specific places where they used to tell the sex of the fetus. We were able to control the district level scan centers. I will come to that implementation issue later, just keep it in mind. See, there is a lot of village health nurse, VHN is accountable. Village health nurse, when you do the disaggregated health subcenter wise sex ratio, now the village health nurse takes care of the health subcenter. She is in charge of the whole area. An average tenure is almost 9 years. In any village, when you go back to your village, so if you ask her, she will be there for last 8 years. She knows everything. She knows what is happening with because that area is a rural area. She has good contacts with the Anganwadi Paniyalar, noon meal organizer, teacher and the Panchayat president. Everybody is linked because there are a lot of funds operated jointly by the village Panchayat, that is village health, sanitation and sanitation committee funds. A lot of issues there. She is well networked. The only issue is that now you strengthen her, start asking questions. Why your sex ratio is this bad? Is there any area where they are going? So they will come out with answers. Now, once you start asking questions, then you will get, I'll tell you what answers we got. Leveraging government system. For example, 2-girl child, we have got housing scheme. Chief Minister Solar Power Housing Scheme, IAY schemes. So we used to give priority for children. There is a scheme for 50,000 rupees is given for any couple with 2 child who has done the operation, sterilization. So a lot of schemes are there for women, specific schemes are there. So we leveraged all the government schemes and we used to give specifically for 2-girl child, sterilized child couples houses. We almost given 80 houses. So this is whatever government schemes are there, we leverage it. So now strategies, important strategies, early ANC registration. Spontaneous abortion is a rarity in second trimester. Sex of the fetus can be predicted with accuracy only in second trimester. But to implement the scheme, we have to register every pregnant mother in the first trimester. So that is the basic duty of the VHN. First 3 months, you capture all mothers. If they go beyond first trimester, then the VHNs are asked why this is happening. This is the part of our review. Anganwadi worker, Panchayat functionary, social welfare department, health functionary, all of them are coordinated. It's a coordinated approach because the first person, the government functionary in every habitation is an Anganwadi worker, not a VHN. VHN will have 3 villages. Okay, a VAO will be part of many habitations. A government functionary in every habitation. The unit of real government administration is Anganwadi worker. After Supreme Court judgment, every habitation has got a Anganwadi worker. So Anganwadi worker is the first person who will know that there is a ANC is to be registered. So strengthening the Anganwadi system. And we are the first district in the state where every Anganwadi has got a own building. We have done it almost, now 30 is under construction. Once we finish that, every Anganwadi, we have constructed building on their own. Because Anganwadi building is very important because that is where they come for ANC checkup. Okay. one village will have 6 to 7 habitations. Every habitation should have one. See, the Anganwadi building is almost like a village health sub center. So Anganwadi worker is very much part of the scheme. Then information used to supply. See, now disaggregate health sub center wise data analyzed and localized issues sorted out. Information used to deal with supply side issues. PND did what happened was that auditing 47 cases came up. 17 scan centers were identified. 17 of them. Now what to do? We got the audit report. There is a scan center. Now first what I did was we sent the audit report to them and told them, I called them up personally. I said, I'm telling you this is the information we have received. Now I am again telling you that, and all of them except one were outside from Neyveli, Thittakudi, Athur, Thurayur, neighboring districts. So what we did was I called them up and sent them the report. This is the report we have got. Okay, this is the first step. Please consider there is no need for a person to travel 3 hours to Neyveli to check up. The Mahalakshmi nursing, I'll tell you, find in the papers, we have sealed it. 3 hours somebody travels for a scan. They're not required because so many scan machines are there in Perambalur itself. So we told them after once they understood that we are following up, 16 of them stopped except one. And this person we have to talk to the state appropriate authority for PNDT. Then they sealed, remanded this person, and now that hospital is sealed. Mahalakshmi Nursing Home, Neyveli. You can check up in the net. So this is how we tackle the PNDT Act. So the information we received, we have done. We have talked to the 17 scan centers we identified. Then we talked to them and tried to tell them that we have the audit. We are auditing every abortion, and if you are culpable, you will be, PNDT is easy. PNDT Act is so strong that any scan without informed consent can be taken up, can be punished, penalized. Male birth audit, parents were more forthcoming, no sense of guilt. 17 scan centers were identified, conducted first by VHN, then by medical officer and reported to district administrator. This is the structure. Role of medical officers, very important. Auditing second trimester abortion is post facto actually, with VHN report analysis, male birth, monthly audit. Then reviewing medical officers is also crucial because this scheme is 100% done by government officials. No non-government organizations are involved. It's 100% a government official run scheme. VHN role was 100% early ANC registration, identify patterns and problem areas, interpersonal communication with mothers and relatives to avoid sex determination. Anganwadi worker was the most crucial aspect. Close follow-up of all AN mothers. Data sharing with VHN and attending review meeting on second Tuesday in the primary health center. Here I will tell a story. Again, 2 stories are there. First story is about immunization. There was a village who was not immunizing. 2011 this happened. That village was not forthcoming to immunize. They said that last 3 years before there was an immunization episode and one child fell very sick. So we will not immunize. So my MO went, no issue. So it's a big village. So I went personally and talked to them. I said, please immunize. Without immunization it's not possible. You have to immunize. Then after a long speaking for long, and mother came, okay, send a child. And I said, 2 children were there. She sent 1 child. And I asked her, so then my mother, MO said, then she asked, MO asked, first she sent the girl child. And I said, I never expected that answer. In 2011, so last Pongal Mudichite, a girl came to me, a 14-year-old girl who's in a night dress. So she called me up in the morning. I didn't know she is there. Some girl called me and said that I have been married against my wishes. I am in Thittakudi, Kadalur district. Please save me. I am calling from my maad maker at the phone vaangi na koopudren. Unga number enakku neenga hostel la vandappa koduthirundom. Please save me nu solta. Seri appo na ennoda DSW district social welfare officer ta kodthom. And amma kootittu evening and papa koottu vandanga. Papa vanda odane onnu solla enakku 10th class பரீட்சை எழுதணும் சொன்னாங்க. It's on Pongal January la. நீ கிளாஸ் கடைசியில் எப்போ போனேன்னா ஆகஸ்ட்ல தான் கிளாஸுக்கு போனேன். நீ 6 மாசமா கிளாஸுக்கு போகலையே, நீ எப்படி பரீட்சை எழுத முடியும்னு சொன்னேன். இல்லை நீங்கள் எனக்கு வாய்ப்பு கொடுத்து பாருங்க, 400 மார்க் மேலே எடுத்து காட்டுறேன். பரவாயில்ல, நீ 6 மாதம் கிளாஸுக்கே போகாம 400 மார்க் எடுத்து காமிக்கிறேன்னு சொல்றேன், எப்படி சொல்றேன். அப்போ அடுத்த அவர் சொல்றாங்க, இந்த பொங்கல்ல எனக்கு உங்களை மாதிரி ஆகணும்னு ஆசை, நான் கலெக்டரா வந்து வரணும்னு ஆசை, அதனால் 400 மார்க்கெல்லாம் நான் ஈஸியாக எடுத்துடும். அந்த உண்மையாக இப்போ ரிசல்ட் இப்போ வந்து 21ல், அதுக்கப்புறம் என்ன ஆகும் தெரியும். பட் அந்த இது தைரியம் இருக்குல்ல, ஏதோ ஒரு மாடு மேய்க்கிறட்ட வந்து ஃபோன் வாங்கி எங்கிட்ட பேசி, என்னோட நம்பர் எப்படின்னா அவர் ஹாஸ்டல் எல்லா ஹாஸ்டலும் நம்பர் எழுதி வச்சிருப்பாங்க. அந்த நம்பர் ஞாபகம் வச்சு போயிட்டு தெளிவாக இருக்காங்க. அவர் சொன்னாங்க நல்லா தான் பார்த்தேன், என்ன சித்தி கல்யாணம் சொல்லிட்டு கூப்பிட்டு போனாங்க. Tamil, people who doesn't understand Tamil, okay. So I'm talking about a 15-year-old girl who came and asked me to give permission to write the 10th exam. She has not attended the class for the last 6 months. She was married. They took her to a temple saying that Sitti or that her aunt's marriage. Then they married her off and packed her to our neighboring district. The only chance she got a phone from the shepherd and called me up. And we sent the team. They rescued her. She had no problem, grouse against her husband or something. She said they looked after me well, but my aim is to be a collector. She just thinks, she's coming and telling me that 10th pass, I first have to write 10th, I want to be like you. And she said 400 marks, you just see, just give me an opportunity, I'll score above 80%. So this is for people who don't understand Tamil. So this is the difference which I've seen. The 4 years, at least people who just want to come out of a child marriage, they have the wherewithal, or they have the confidence to do that. And Perambalur now, incidentally, the 12th results you have seen, we are the second best district in the state in 12th results. And in government school, 95% of children are passed in 12th in government schools. So, and all of them, I can assure you, all of them will end up in a degree. I'm not, after degree, I don't know, because we have got enough government seats in arts, government colleges for degree students. So, these are 2 incidents which I've seen. One is the immunization incident, and this last incident about child marriage in the Pongal last January. So Anganwadi worker had a big role, because in whatever happens in the field, Anganwadi worker is the first point of contact, and she is the first one to tell what is happening in the field. District administration, my role was to review the sex ratio at birth every month, okay. Sensitization of public to government, all social welfare scheme sensitization, but review means like age of ANC registration, last menstrual period, how many days have lapsed before registering the mother, and what is the hemoglobin, and what is the spacing between 2 deliveries. So we have got a format whereby that format will easily tell you that what is how the VHN is functioning, how deeply she is able to go and do this ANC care. We have prevented 358 child marriages, and if you can Google, you can see the latest judgment on Perambalur child marriages. And another gender issue is that 60% of 174 cases, dowry death cases, belong to underage marriage. 174 cases that any girl dying within 7 years of marriage is to be audited by, it has to be, the inquiry has to be done by the sub-collector. So it is not a 174 CRPC case, okay. So the 60%, and you look at that, 70% of children, they are waited for free surgeries. Okay, when you look for congenital heart disease, we found that 70% of girl children just waited, while only 30% of are free under the insurance scheme. So when I asked that, same family, 2 children were there, so family is more willing to put money. I'm not saying that this is something which for use researchers to go into. Again, board exam, immunization experience already I have. So gender is something maybe very not easy to tackle, because it's something basic fundamental assumptions of the society, and as administrators we are not beyond a point, we cannot go inside and look into gender and other issues. So these are the key elements by which we were able to do this. PNDT Act as such is a very good act, but the problem is that the act is only supply side, not the demand side. So our intervention was to understand where the demand is from, and what is the pattern of demand, and who are the people who are supplying it. The demand-supply link we are trying to break. I'm not saying that we are able to do it completely. Now, I can tell you that it is not easy to do it completely. Now, the same scan center has done scanning, started scanning in the night from 2 to 7. And they are using this mobile scanners. So, again, this is a constant fight. You cannot stop your God. It will keep on happening. But act itself is not enough. And this strength of the program is purely government official driven program. I not saw its strength because Perambalur there is no other non-governmental organization to take it. It's rapid results, easy to simple and easily replicable, no additional expenditure, and it will improve the ANC care. Look at MMR, our maternal mortality rate reduced from 153 to 65. We have reduced it by half, 50%. Maternal mortality is the prime indicator of the care, quality of care. Not yet tested in urban areas. Dedication in result weakness. Urban areas, how far it will be feasible to implement, because it's most about interpersonal communication and the BHN's presence in the delivery of ANC care. Dedication in professional, it needs a lot of review. It's not an easy thing to do. A lot of time needs to be spent by district administration. There's a lot of departmental coordination. These are the weakness of the program. Opportunities, flexibility is there. Government has asked all districts to do this program now. Challenges, social prejudice, healthcare delivery professionals and scans, and there is a nexus obviously, and it's intensely monitored top down. It is not a bottom up approach. So this is the challenges. So gender specific intervention, these are 350 child marriage, age of first delivery, registration improved by 7 months. First delivery, primary, age of first delivery means primary. We used to have child marriages, primary were around 18 years, mothers. Now it has become average age, mother's age has become 19 years and 1 month now, as of now. So there has been an increase in the primary means first delivery, age of first delivery. If you look at the average age of first delivery in the Perambalur district, it is improved by 7 months. Now we had done a nutritional program for government school children, pilot supplementary nutritional program. We were able to get results of 4 kilos addition in weight. That is for nutritional aspect. Audit revealed 47 cases, excision 17 scans, and these were operating outside district. This is a PNJT plus scheme. Okay. It can be part of a 20-point program. So we recently got the Prime Minister's Award for Excellence in Public Administration for this intervention. It is I think it is replicable, but it will not get a drastic result like in a rural area, in urban areas. But still, it is worth questioning which are the pockets of adverse sex ratio. So here these are the. I think my program ends here. It will take 20 minutes. I just run through what we have done. So you can please ask me questions or issues. And this is one focused intervention which we did for sex ratio. So you can please ask questions. It's like treating like tiger. If you conserve a forest, you save tiger. Rest everything will be taken care by itself. It's similarly, if you take care of this thing, so many ripple effects will be there. Unless until you have a proper antenatal care, this program is not possible. So there's a lot of other benefits from this. It's like apex predator.
Thank you very much for a fascinating can achieve, provided of course they are motivated or the program is driven by a very motivated person like the one you see before you. That you can now ask your questions. We will give time for that. So please, anybody who has a question, you're most welcome to ask.
There are two things, either you understood everything or nothing. Only in between you will have.
The vacancies or the lack of availability of Anganwadi workers or VHNs. How did you manage to tackle that?
Collector is the appointing authority for Anganwadi.
So you are
VHNs are, there are no vacancy.
okay.
Nominal vacancies are no more there.
Which happened in Perambalur district, is there any socio-economic background behind it? Is it happening only in the certain community or it's happening in all communities in the district?
See, in North Andaman, anywhere, you can just look at the age of primary. Primary means the first delivery. You can see that, then you can calculate the problem. Child marriage, the problem here is, it's a very tough thing to regulate. We have to go in the night. The news will come one day before the marriage. Okay, you have to go in the night and to convince the people. The arrangements would be made. Then to bring the child present before Child Welfare Committee. If you stop a child marriage, at least 10 officials have to be involved. The BAO, that village Panchayat Secretary, the President, the District Social Welfare Officer, Integrated Child Protection Scheme Officer. So to take the pain to stop a child marriage, because they legally say that it has to be produced before the Child Welfare Committee that same day. Child Welfare Committee will say that what is to be done. The marriage is, again, they are insistent on marriage, you have to go to JM, Judicial Magistrate, and get a restrainment order. So, if you take up a child, stop a child marriage, it is not easy. Just stop and pay. You can just don't do. It is not the issue. It has to be, it's a long process. So, every child marriage stopping involves at least 3 hours of work for a government official, and that too night. The information will come in the night. The information will come mostly from schoolmates. Okay. I received at least 20% information from boys. Okay. You can calculate why it is come that way. Okay. Okay. Basically, they will get some hunch about something is going on. So, family will get them married. Then 30% is from widowed mothers. Mothers getting their child. It's like a bird, you have to get them married. Then there is no community. Every community is equally prevalent in every community. I have not seen any specific, and that too, money is not, poverty only in the widowed mothers. But there is no specific correlation. Child marriage is rampant. I don't know. Last week's Economist has carried about marriage quiz. Did anybody read that marriage quiz happening in China and India? Last year before that. 2 weeks before, the Economist. The Economist is there in your library. Go through that. It talks about marriage quiz. Because girls are not available. Because of 100 million missing women, the girls are not available. Now we are going to face a marriage quiz. It's it is written very well about China and India, how they are going to face the marriage quiz. That may be another reason, demand. And this 13-year-old girl is getting married to a 39-year-old second marriage, this last marriage. So, demand for brides, not many girls are available, and what you say, and poverty. Specifically, I cannot pinpoint because I got the data with me. 15, 22 girls, 16, 67 girls, 17, 119 girls, between 17 and 18, 131 girls. Okay. So out of which they have been put back to school. 122 girls have been put back to school. 67 is pursuing college education. Okay. So out of that we are still 40 has been dropped out permanently now. So this is what we have done. We are able to put out of 358, 200 back to education system. And this year's 12th, all 19 child marriage victims are passed. If you look at the Hindu report, all 19 child marriage victims have passed in this year's. And many people have offered to give them nursing admission free. Hospital has come forward to give them BSc nursing free of cost. So the victims we are following up is more important. So if you are able to put them, for 12th pass பண்ணிட்டு என்ன பிரயோஜனம்? காலேஜ் கிடைக்குமா? இப்போ நீங்கள் கல்யாணம் நிப்பாட்டினீங்க படிக்க வைக்கிறீங்க அதுக்கப்புறம் என்ன பிரயோஜனம்? இப்போ engineering படிக்கிறாங்க. There are girls who are studying engineering. So ultimately if you can show them a child marriage victim gets a government job in the village, then I think that village will think twice before getting somebody married. So it's about continuous process of rehabilitating or putting them back into the mainstream and showing them that okay, kalyanam pannanalum hostel, we provide them hostel and give them good education so that they pass. Passing, a child marriage victim passing is very important. 100% result this year for us in 12th. 19 girls wrote, all 19 passed. Highest mark was 898. So what I am trying to say is that, see, there is no specific patterns. It's one community, no. What I have seen is poverty is an issue, and if we can show them that, okay, life process, they can study. And and about the caste is another elephant in the room. You know that some affair will be there, they will come to know about it. And that is another thing which is constantly prying on the parents' mind. So it's more like tribalistic feeling. So I cannot pinpoint anything. You have one more data, I can give you more data. What is the family? But there is no preponderance. It's equally divided between communities and equally divided between economic communities. Not specifically that only poor are doing. Even middle income is doing. But you cannot say rich in the center. Okay.
Thank you.
Remarkable example of what government administration achieve. Normally, we go on blaming the bureaucracy for all the difficulties. For example, every index, even today there was one index, Human Development Index, Hunger Index, our position is not improving. In spite of the fact we have so many schemes, we have hundreds of schemes. But I think what you have shown is some kind of, you are a catalyst of cooperation. You have a catalyst of coordinated thinking and action. What I want to ask you is, such examples should really be known much better because many times we are overwhelmed by the problem. We are overwhelmed by the size of the problem. the sex ratio, whether it's sex ratio, whether it's malnutrition. We think the problem is so vast, it is very difficult to, even other diseases, communicable diseases, non-communicable diseases are growing. And examples of this kind are they mentioned in the IAS Academy in the training program, because the younger people who go there should really get a sense of confidence that they can achieve, they can accomplish. These are not problems, because it's really sad. India has so much knowledge, so much experience. But nevertheless, in almost all human development indicators, we are either stagnant, our progress is so low, in spite of, including nutrition problem, malnutrition problem, and so on. So I want to ask you whether people like you are invited to Missouri to give lectures to the younger generation, and whether case studies of this kind are used in the training program.
So the answer is here. This presentation is the same presentation, similar presentation I have done last month for Missouri trainees. So the presentation name itself is LBS, and if you see that, it is written LBS. Actually, I have only changed the amount of time it has to be put in. It needs to have a small district. Every BHN you should have an interpersonal relation. Every BHN should know you. And the problem is that a bigger districts, it's really difficult. It involves a lot of time and effort. And every month you have to talk to the BHN, what is happening, what is the pattern is happening, where they are going. And the audit has to be followed upon. In a bigger district, it's, I don't know if I will be able to do that. But the problem is that it is possible if questions like this are, like what is the sex ratio of birth in district wise. If you analyze and ask, 20-point program, Prime Minister 20-point program is there. So if you add that, okay, what are the problematic health sub-centers? I have got health sub-centers with sex ratio 420, 410 consistently. So obviously something is wrong there. So if you can ask that kind of questions, the questions can be asked, and obviously people become more alert. So it can be part of a bigger scheme of things. And Academy has already, 3 or 4 times they have asked. So the implementation issues, it has to be part of a bigger, part of NRHM or RM and CHA, part of National Health, Rural Health Mission. It will come. That's what the discussion is going on. So that is a solution for that. If the questions are asked, simple questions that what is the sex ratio of this health subcenter. But this presentation is from Labasana only. Yes.
We are very happy that the government is taking it up seriously and is planning districts. I think the most important point is the intensity of the work required and the amount of time and attention that is needed from the top official in the district. And as Mr. Darez Ahamed has pointed out, it's very easy to, or easier, I won't say it's very easy, it was a tough job, but easier to do in a small district. So I think that has a larger message, because people are talking about, dividing up states into smaller ones for better administration. That has been the reason for the increase in many states in the last 2 decades. So that maybe the same is applicable at the district level. The smaller the district, the more superior the administration will be, because people with the same abilities will have more time to give. Now, whether that will be possible or not, of course, we cannot say. The other point I wanted to make was that this is the first time I have seen any government intervention on the demand side. He said this right at the beginning. I don't know how many people noted the importance of that, because almost all our government interventions are on the supply side. You provide some facility, you provide some services, but we have not found out which are the ones which people want and which are the ones which they are resisting and why they are resisting and how we can change demand. I think demand is the most difficult factor to influence. So I would once more congratulate Mr. Darez Ahamed that how he has managed to tackle the most difficult situation. Now, of course, government is changing many things into cash transfers. And that is a very demand-directed, but without the follow-up, People will demand whatever they want, and they may be demanding. Now when you give cash transfers, it doesn't mean they're going to spend it on nutrition or whatever your objective is. They will spend it on whatever they like. So I think that's a highly negative scheme, though it is promoted as one which, gives people the power to decide rather than having to follow the government decisions. But if we look at the other side, it means if you give a cash transfer, the person may choose to spend it on something very negative, and there is no way that you can stop that. So I think the whole move for cash transfers is a very negative one. They are given as inducements for people to do certain things. Again, it's an incentivization model, that you do something not because you've changed your mind, but because, or you've appreciated the point which is being made, but you just do it because you're getting the money. And that is more and more the trend in government administration, especially in northern states. For example, none of the states has a VHN. They have ASHA, and ASHA is paid per, it's a contract job. For every woman she brings to the health center, she gets paid something. So there's no motivation, no social contact, no follow-up, nothing. And I'm very proud of the fact that Tamil Nadu government refused to implement that ASHA scheme. So it is a government with more vision, at least on social issues. They refused to implement it. They said, we don't need any ASHA. We've got our VHNs and we will work through the VHNs. So I think that kind of outlook at the top, at the state level, is also very important, because states do have a lot of freedom within the country to do things in their own way. The same money can be, which comes from the central government, can be used in different ways. And here is an example where, as he pointed out, it's really the achievement of the VHNs. They were the people who did the job at the ground level. And no ASHA will do that. No ASHA can do that. No ASHA is expected to do that. So just, incentivizing people is a very, I think, a negative approach, and many of us have protested it. I'm not saying something which is not being debated among the NGOs and the public, for instance. There is a lot of discussion about the negative impacts of a cash transfer mode, and just because some other country is doing it, we're taking it, or because the World Bank approves of it, we are doing it. But I do not know whether in our own system it is applicable or not. And the last point I want to make is to once more congratulate him for working on the demand side. Nobody has ever thought of it. Government is always working on supply side. In this very issue, I remember, I am an active member of the group that was called CASA, the Coalition for Abolition of Sex-Selective Abortion. They were very sincere and devoted people, and they spent a lot of time, pursuing the scanning centers and finding out who was doing the scanning, and then, filing a case against them and all that. With all that hard work, I think they managed over 5 years to actually find proof in the case of 5 or 8 scan centers, and then to bring them to court was another big issue. And usually these NGOs don't have the funds to do that. I mean, if you had evidence about scan centers, you could straight away file a complaint. But the NGOs have to struggle and then fight a legal case for which we don't have the funds. So it really didn't get very far, except in creating a lot of awareness among the community that sex-selective abortion, firstly, is not a desirable thing, and secondly, is not a legally permitted thing. And of course, people are very fond of breaking the law and doing it in secret. It's very difficult to catch them. Here's a wonderful methodology for catching them even before they do it and preventing it from happening. So I think a governmental approach in these cases really works well. So when government officers start implementing the laws, we always complain that our laws are very good but they never get implemented. Well, here's a marvelous case of somebody implementing the laws, especially the laws which are unfavorable to women. So thank you very much, and we seek your permission to record this and put it on our website. Of course, we'll send you the material. So can we have the slide presentation also, if we can make a copy of it?
Yes, ma'am.
And then we'll send you the text
Yes, ma'am.
so that you can, you know, make whatever modifications you like. It will be your approved text, and we would like to put it on our website. So I have your permission?
Yes, ma'am.
Thank you.
And once district entomologist, there's a district epidemiologist, and see, the systems are very robust in TN, and that is why the VHN, public health inspectors, that is under the control of, so this much robust health, so the preventive aspects of, like say the demand side, the preventive aspects of healthcare is one of the most, because I worked in Kerala Government Primary Health Center. So that's what I'm telling you with, even as developed a state as Kerala, but what I have seen there, we don't have that kind of infrastructure of the manpower. There is a district entomologist, epidemiologist. So the manpower is huge in TN, and public health wise, I told you about the plague example. Still there are plague workers who can really see the rat and see the fleas in Hosur. So that we are the only state which is still having that. So what I'm trying, see, this scheme is possible in TN because of the strength of our public health delivery systems. Like as Madam said, VHN, that is one very important aspect we have to keep it in mind. Tamil Nadu Public Health, there is a paper on Tamil Nadu Public Health written by, there is a World Bank paper on Tamil Nadu Health, Tamil Nadu Public Health. It is written by an IAS officer, I think Somnathan sir. Somnathan, T.N. Somnathan. You can just have a look at that, and it will clearly explain why it is a superior system. Okay. So that is one point which you should note here. Otherwise, it's not possible in a place where with Asha workers, it is definitely not possible. Any more questions? I hope it's okay. For me, this is a really wonderful opportunity, and I'm really privileged to meet the legend itself. I still remember I won a quiz when I was in 8th standard, saying your name. The final question was about you, and I think this institution, who won the World Food Prize, I was in 89. The quiz answer was him. So you have won me the first quiz trophy by saying your name. Thanks. It's an honor to meet you after such a long time. Thanks.
And first, our thanks to the distinguished speaker, Dr. Darez Ahamed, who accepted our request and shared his extremely valuable experiences with us. And our heartfelt thanks to our professor, dear professor, because for his guidance in choosing the speaker and presiding the seminar. And we thank Madam Swaminathan for immediately accepting our request to chair the seminar and sharing a valuable thought with us. And our thanks to all those who come today, particularly Scope International volunteers and our colleagues from other countries. And our thanks to our informatic teams, Mr. Tamil and Mr. Kannappan, for facilitating digital connectivity so that our colleagues from different field sites would listen to the proceedings happening in Chennai. Thank you, Ananda.